to all our Gold viewers around the world. I am Christine Starica, IBCLC and MC for Gold. I'm chatting today with Dr. Pavel Prusakov about his upcoming presentation titled Hold the Meds, a Guide to Toxicities of Common NICU Medications. Now, this presentation is part of the Advancements in Neonatal Pharmacology lecture pack as part of our Neonatal Online Conference 2023. So welcome, Dr. Pavel Prusakov.
Hi, Christine. Thanks for having me. How are you?
Oh, great. It's great to have you here. We are looking forward to hearing a little bit more about you and what you do. So we'd love to know, where are you in the world and what do you do there?
Yeah, I'm a clinical neonatal ICU pharmacist, and I also do antimicrobial stewardship at Nationwide Children's Hospital in Columbus, Ohio.
Wonderful. One of the things that we could see, when we were looking for speakers, we were looking for folks who do a lot of teaching, a lot of presenting, a lot of research, a variety of things. And one of the things that really stands out about your bio is how much teaching and precepting you do. So I'd love to know, what makes that so important to you that you spend so much of your work focused on teaching the next generation?
Yeah, I think teaching is super important, especially in clinical practice, because when you go through college, pharmacy school, med school, you tend to kind of memorize things for the most part, and critical thinking is just you don't get to use it as much until you get into practice, and it's really important to for me to teach my pharmacy students, residents. I work with neonatal fellows, even seasoned practitioners, to really make sure that we are following latest and greatest, and also make sure why. Just because someone said so once, it doesn't mean it should be followed for eternity without questioning why behind it.
That really resonates with me. I'm a lactation consultant, and we find the same thing. We have a robust but also diverse way of mentoring new lactation consultants. And, as you gain experience in your career, one of the best ways to learn more yourself is, of course, mentoring and teaching others. But it's just to make your experience and your expertise even more robust, it's so important to be, working with many mentors, getting that type of feedback and insight, and always teaching understanding the why of what we do. So, like you mentioned, that you are very interested in how practice changes and how research is supposed to change practice, but sometimes takes a little while to do that. And it can be, frustrating. It can feel like it's holding us back. So talk to us a little bit about how you feel about that whole process.
Yeah, I mean, it's, we always get these new drugs are always coming out, and primarily they're being studied in adults. And, um, European Medicine Committee kind of requires companies to do some studies in pediatrics and even neonates, but a lot of the times they tend to have a hard time recruiting these patients because they don't, we have a very hard time adapting to new medications, primarily because our patients tend to be very fragile and we tend to protect them. But a lot of the times when something new comes out and it's adequate evidence, we also tend to have that still thought process of, well, we can't use the new thing in our babies until somebody else uses it, but nobody else wants to use it. And so we have to start somewhere, and we have to really follow the evidence and really be critical, but also recognize that sometimes we do have to adapt new practices earlier, just based on again, kind of weighing out the risks and benefits. And when you talked about you being lactation consultant, a really good example is a new monoclonal antibody comes out, and mom is on this monoclonal antibody. When you look up the medication, is it safe in breastfeeding? It'll say no data available. But when you actually think about, and again, going back to the critical thinking, when you think about these drugs, they're really large molecules for the most part. And when you look at different properties of these drugs, even though there is no data available, a lot of the times these drugs are actually safe in breastfeeding. I'm kind of going on a tangent, even though there is no data, they're not, you know, or bioavailable orally, and they don't actually go into breast milk. Just because there's no data available doesn't mean that it's not safe to breastfeed to babies. And so I kind of going in full circle, and um, it's important to think about things critically, but also it's important to recognize when data is important, or in the case of monoclonal antibodies, maybe you don't need a lot of data in order to show that these drugs are fine and safe in breastfeeding. So
Those are such good points. You know, critical thinking involves so much about in medicine and healthcare, you know, the physiological plausibility of a technique or an intervention and the mechanisms of action. And sometimes we don't have all the data that we need. But that really kind of brings me to my next observation about your work, that you're involved in research, because when you do have to sort of forge ahead and use these new concepts or new interventions, if you're going to try it, you better be keeping track of it, right? Somebody better be
absolutely.
writing down the outcomes. So if you want to talk a little bit about your research, that you're the principal investigator on a study, we'd love to know about that.
Yeah, so I have a couple studies going on, but the one that is actually currently funded is a no more antibiotics and resistance in surgical patients in the NICU. And really a lot of these patients tend to be, we don't have guidelines, people don't feel comfortable because they're really, again, kind of going back to they're really fragile, and people tend to be like, just in case, we'll give this antibiotic. But in the end, in my presentation, I talk about different toxicities, and all of these antibiotics are not benign, not from the standpoint of antimicrobial resistance and shifts in microbiome, but also they can cause direct damage to kidneys, liver, and so on and so forth. So just because patient underwent surgery and people are concerned about infection, we also need to be concerned what damage are we doing with these drugs. It's kind of funny. It's always people think, oh, I'm a pharmacist, that means I want more drugs. But actually, I'm a pharmacist. I want the least amount of drugs possible while still being effective. And that's why I undertook that project, because it hasn't been done before, and we prospectively looked at how the drugs are being used and implemented several interventions to potentially reduce the amount of antibiotics used in surgical patients in the NICU.
And why is that really important to you? I mean, how did you get into studying or, you know, focusing a lot of your career on reducing the amount of medications rather than simply learning about new things that come along? Why does that matter to you?
Well, I mean, it's always I've been in NICU for over 10 years, and we're starting to see now every time we have a NICU reunion, I see patients who are going to school, and
Oh.
seeing these patients kind of progressing through their life. And we know that especially antibiotics, and in my presentation I talk about direct side effects such as nephrotoxicity or liver toxicity, or even seizure potentials. But these drugs also have been associated with worse neurodevelopment outcomes due to possibly the dysbiosis. And so um, a lot of it is really the side effects that we don't necessarily see right away. And it's really hard for us to gauge the risk if we don't see the risk right away, because you think, oh, I'm concerned about this patient. This patient has sepsis. We have to treat sepsis for 14 days because some book said so. But we're trying to focus to make sure that you should only treat sepsis for 7 days, because any additional day can cause renal toxicity, maybe hepatic toxicity, maybe dysbiosis that have been associated also with all these side effects further and down the line.
Well, I have to say, as a parent, I am really glad that there's someone studying that, because we all want to protect our children. And that is a really important piece of it, to, like you said, to really look at those long-term outcomes, not just the short-term. Understanding, you know, it's so easy in healthcare to be very focused on the short term and wanting to fix things, and, you know, and wanting to use the tried and true methods, and not, you know, feeling scared about reducing length of treatment and things like that. But I'm really glad that you are studying, ways to always be fine tuning and clarifying. Anything you would like to share with our viewers about what will be special to them about your presentation? Why would you like them to watch?
Yeah, I think that my presentation will provide is a lot of the context for some of the things that you might observe in a NICU, but we don't necessarily how to really recognize what's going on with the patient and what are some of the practical things um, that you can implement to either kind of shorten the maybe not kind of like the if you see somebody having a seizure and you see that they're on these antibiotics, it'd be good to speak up and talk about, all right, do we need this antibiotic? Maybe it's not the one that's causing the seizure, but should we stop it? Because it's always good to ask questions and to be everybody should be adequate for the patient. The nurse, the pharmacist, the physician, and the respiratory therapist, everybody, right? And so just because somebody might not be necessarily the decision maker, it's always good to ask questions just because, oh, I remember Pavel was talking about this in their presentation, not just because this is definite. There's nothing definite in the NICU, but it's always good to say, I saw the creatinine as being kind of elevated from the day before. Should we reconsider this antibiotic or should we maybe stop it early? Is this patient still are we still concerned that this patient has sepsis? It's not necessarily about having the definite answers. It's about knowing when to kind of raise a red flag and say, stop, let's think about the patient as a whole and do we need this drug or not?
Well, I love that thought, and that's a great way to interest people in, asking more questions and getting people more involved. And like you said, making sure that every member of the care team is an advocate and feels empowered to ask questions and to be part of those decision-making processes. We are so proud to be able to present your talk in our our lecture pack. This presentation will be available on May 30th. And to find out more about this presentation and the other presentations that you can also watch as part of the Gold Neonatal Online Conference in 2023, go to goldneonatal.com. We hope to see you there. Thank you all for watching. Thank you, Pavel. We really appreciate your time.
Thank you, Christine. Thanks for
All
inviting
right.
me.
It's our pleasure. Thank you, everyone, for being here. We'll see you soon. Bye-bye.